Hello and welcome back. Our next talk is Vaccination Hesitancy, Your Client's Perspective, understanding how clients think, the psychology behind their decision-making, and how to engage. My name is Dr. Erica Carroll, and I'm a veterinarian with the global marketing team focused on companion animal vaccines at Merck Animal Health. Before getting things started with Dr. Belshaw, a few housekeeping items to remember. Notes for the talk will be emailed after the event. And should you experience any technical problems, please use the information at the bottom of your screen. It's now my pleasure to introduce Dr. Zoe Belshaw. Dr. Belshaw is a veterinary surgeon specialized in small animal internal medicine. She holds a PhD from the University of Nottingham, where she investigated welfare assessments in canine osteoarthritis. She has worked in general practice, referral clinics, university teaching hospitals, and charity practice. She is currently involved with collaborative research on how veterinary professionals and owners make decisions about pets that need veterinary care, how the quality of life of those pets and owners can be best assessed, and characterizing the pandemic puppy phenomenon. Dr. Belshaw, a very warm welcome to you.
Thanks everyone for coming. So today we're going to do a talk about vaccination hesitancy and your client's perspective. What we're going to cover is what actually vaccination hesitancy is compared to the anti-vax phenomenon. They're slightly different. What the causes might be and how these might differ between people choosing about themselves, people choosing on behalf of their children, and people choosing on behalf of their pets. And finally, what we can do about it. So many of you may recognize this man. This is Edward Jenner. He was a doctor who was based in the UK. And in 1796, he performed the first true vaccination. He realized, as did many people at the time, that milkmaids, so people who milked cows, caught cowpox very frequently, but didn't go on then to catch smallpox. And smallpox at the time was a devastating disease. And so he took some lesions from a lady affected with cowpox, vaccinated an 8-year-old boy with those, and he developed a low-level case of cowpox. Jenner then, a couple of weeks later, tried to give him smallpox by taking lesions from somebody who was affected with smallpox and injecting them into him, but the boy didn't get smallpox. And that was the first demonstration that cowpox could cross-protect against smallpox. So yes, it's an interesting bit of history, but also it was the start of the quite strong vaccination hesitancy and anti-vaccine movements. Because when Jenner went to London to try to recruit more people to be vaccinated, he was met with a huge wave of suspicion. And as this cartoon from the time shows, people were very worried that by being vaccinated with this kind of cow medium, that they would actually start to turn into cows. And you can see behind the lady there, the people that have already been vaccinating are developing cow body parts. So there was a huge wave of resistance. And so really, hesitancy, concerns about vaccination genuinely have been around for as long as vaccines have. Ultimately, Jenner's was a great success story, and it still remains that smallpox is the only disease which has been eradicated completely by global vaccination in the late 1970s. And this graph shows the trajectory of decrease as those vaccines gradually became implemented worldwide. And obviously, since Jenner, there's been an absolute explosion in the number of vaccines that are available for people and for pets. And I think historically, vaccination is something that's kind of ticked along in the background, really, in our public conscience. It's been there for many of us, very fortunately, when we need it. We haven't really had to put too much thought into it. And then all of a sudden, a few years ago, obviously the COVID pandemic happened. And then on our TV screens, on all of our media, suddenly there were mainstream politicians talking about vaccine, about why it was important, about why we maybe needed to get it, what the risks of vaccination could be, and whether even COVID was a disease that required a vaccine. And this is a huge change. So vaccination's suddenly gone from being something that we just talk about to healthcare professionals to something that's really dominating our lives and our freedom. And that's probably really changed how people, at least around COVID, view vaccination, because we've had to make conscious decisions about it. And we've seen this quite contested real-time information emerging about what vaccination may or may not do, how they're developed, and how safe they might be. So when we're talking about what vaccination hesitancy is, what do we mean? Well, there are several different definitions. The World Health Organization, who are probably the main people that define this, to start off with, described it as a delay in acceptance or refusal of safe vaccines despite the availability of vaccine services. And indeed, the World Health Organization have vaccine hesitancy listed as one of their top 10 global threats. So it's genuinely something that people are quite concerned about. From definition, from their perspective, important to note it's a delay in acceptance or refusal. It's not somebody who's saying, I absolutely don't want to get vaccinated. It's somebody who's still thinking about it. So perhaps a better definition that was from a lovely paper by Larson in 2022 was that vaccine hesitancy is a state of indecision or uncertainty that precedes a decision to get vaccinated or not. So we're talking about that time point where people still haven't quite made up their mind. And they might go one way or the other. They might say, yeah, definitely, actually, I want to get vaccinated, or no, I don't want to get vaccinated. And Larson describes it as a time of vulnerability and opportunity. So they're vulnerable to lots of information that's swirling around them. And it's a time of opportunity for healthcare professionals to get the right information in place to help them make a decision, which is to vaccinate if we think that's the right thing to do. People who are vaccine hesitant can change their minds and change their minds again. It may be a really iterative process where, depending on what new information's come in, they may then have a different viewpoint. And also importantly, it may differ with the disease involved. So it may be that some people are hesitant about, for example, a COVID vaccine, but would be very accepting of a flu vaccine for a variety of different reasons, depending again on the information that they're given and how they feel about it at that time. Important too then to recognise the difference between being vaccine hesitant and this idea of anti-vax. And I think the anti-vaxxers maybe get a disproportionate amount of press relative to the proportion of the population that they actually occupy. So anti-vax is somebody who's really ideologically committed to not vaccinating. They genuinely believe that for whatever reason, we shouldn't get vaccinated, so they shouldn't get vaccinated themselves, and probably that nobody should be vaccinated. And again, it may relate to a specific vaccine or to all the vaccines in all the population. So a hesitancy is this uncertainty, not sure what to do yet. And one of the camps of vaccine hesitancy may translate to, probably a small one, is people who, having weighed up the pros and cons, have an anti-vax viewpoint, which is, I don't believe in vaccination, but they are different. So down the left-hand side is a list of countries. The green bars are people who would definitely choose to get vaccinated. The bars in red are those who would be much more hesitant to do so, or even would say they definitely wouldn't get vaccinated. And so you've got countries like China, Brazil, and Australia at the top, where most people were keen to be vaccinated. And at the bottom, France, Hungary, Poland, and Russia, where people were more hesitant. And so you can start to see that perhaps in relation to COVID, and it also maps onto other vaccines, there's a global, national level of vaccine hesitancy that varies from country to country. So that's certainly one of the factors that's widely recognised, that people in different countries have different levels of trust in vaccines. What else is there? Well, actually, it's really, really complicated. And COVID has been a great time for people to really delve more deeply into vaccine hesitancy, to try to understand what it is that defines somebody who's vaccine hesitant, why they have those beliefs. And the list's pretty long. Here are some of them. So these are from multiple different systematic reviews, so lots and lots of evidence sources being put together. And the references for these are in the handout that you have to accompany this talk. There are two broad groups, really, of reasons that people will be vaccine hesitant. The first one is because they've been presented with different information. So maybe there's a new vaccine or a new vaccine strategy that's come out. Perhaps there's a new government policy, for example, compulsory vaccination can be very divisive. Some people are very unkeen for the state to tell them what to do. So a vaccine that moves from optional to compulsory may be enough to nudge some people to thinking, actually, no, I don't want this because I don't trust why the government are making me have it. I want to be able to choose. and my choice has been taken away, and I don't like that. New information is really important. So, for example, vaccine risks being highlighted in the media, and a great example of that was the MMR paper published by the very discredited former Dr. Andrew Wakefield that drew a link between autism and the measles, mumps and rubella vaccine. And that's absolutely, completely discredited information now, but at the time it was a big story and changed a lot of people's minds about the safety of that vaccine and made them a lot more hesitant to have their children vaccinated with that specific vaccine. And finally, in this group, social media influences this whole idea of fake news is a really burgeoning trend in vaccination hesitancy. And we think that's an increasingly influential group, people reading things on social media and believing them, even though they may not be evidence-based in any way, manner, shape or form, and actually they may be completely false. Then you come into the people's intrinsic aspects of vaccination hesitancy. So these again are all things that have been evidence-based to be linked to vaccine hesitancy with some or other vaccines, again, predominantly COVID and people in this list. So age is important, as is ethnicity. Nationality, we've already discussed. Socioeconomic status, so typically people who are less well educated, have less money, less good access to good healthcare information, tend to be more hesitant. If you're healthy, you may be more hesitant because you haven't seen the need for vaccines. If you're pregnant, you may be more hesitant because you want to protect your child, and very few vaccines have actually been tested on pregnant women. Again, that was a really big thing during COVID, where that information only took a long time to come through about their safety. Political views can be important. Health literacy, what you understand when you read a piece of information, how able to appraise evidence you might or might not be. And finally, a group of beliefs. So how do you feel about your autonomy to make your own decisions, about science versus nature, about the attitudes of your family and friends around you? Because it's very difficult to stand out from the crowd sometimes. If all of your friends, your friendship groups, your family are very hesitant or have decided not to get vaccinated against a specific disease, it can be quite hard for you to stand out from the crowd and say, actually, I am going to do that. And in some cases, that may mean that you're ostracized if those other people have quite strongly held beliefs. So people tend to move in kind of bubbles where people around them do the same thing. And finally, trust and confidence in healthcare professionals. In some countries, there's big evidence that there can be increased by being involved in a different concurrent health campaign or something like that. So if you're looking at a typical vaccine hesitant person, if we're constructing a model vaccine hesitant person, they would typically be a younger female rather than an older male, an ethnic minority in the country in which they live, of lower income and lower education level. In the States, they'd be, at the moment at least, be more likely to be a Republican than a Democrat. Typically, they would have nobody near to them that's been affected by the disease in question, and they'd be getting their health information from poorly evidenced sources like WhatsApp, Facebook, TikTok, places like that. And social media is a really big problem at the moment. And one of the big challenges is that you can be on social media and be exposed to views of other people that you don't know. So if you think how Twitter works and how Facebook can work, you may see comments that are written by people that you don't know who have very strongly held beliefs and are saying things as if they're fact, which they may well not be. And a real challenge, twofold challenge, has been Twitter use by foreign states, which is really seeking deliberately to undermine governments by seeding hesitancy and distrust in governments. And also what we call blue tick individuals, so people who may have that kind of blue tick, which is taken as a trust badge on Twitter, who may also be sharing information that's entirely incorrect. And when medical doctors do that, that's a real challenge for people to disentangle what's true and what isn't. And during the pandemic, again, WhatsApp sharing of disinformation was a big problem. One of the big challenges for people when they're trying to decide whether or not to get vaccinated is whether or not the vaccine is safe. And there are a huge range of concerns that people have expressed about vaccine safety. Here are just some examples. So historically, many of the vaccines contain mercury as an adjuvant, and there was a lot of concern about whether or not these vaccines could lead to cancer. A broad concern for people who just don't really trust vaccinations in general would be that they're overloading and weakening the immune system so that the body could do it for itself. But by giving all of these foreign materials, all these vaccines, that we're effectively making ourselves more susceptible to getting disease and not protected. Some people believe that vaccines can cause allergies. We've already discussed this idea of MMR causing autism. And I've put here that the USA had a belief in that was stronger than that of other countries. And we'll see as we go through this list that nationality effect again, which can be quite vaccine specific. So hepatitis B vaccine causing multiple sclerosis was a big concern for some French citizens, more so than in other countries. It wasn't sufficiently safety tested just because how quickly it came through and how much in real time we were able to see the process of that testing. And there was an idea about COVID-19 vaccines being linked to 5G masts, which was quite prevalent in some parts of the States, and that COVID-19 vaccines could contain tracking microchips or GPS trackers. And these latter two might seem a bit surprising, but actually such was the concern about there being microchips in COVID-19 vaccines that governments, this is a Northern Ireland government issue, were putting things out on social media to counter these concerns. Genuinely, people do have these beliefs and they're strong enough to stop them getting vaccinated. And it's really important that we don't laugh at or belittle these beliefs. They might be very surprising to us and very improbable, but to those people, this information that they're seeing, they're interpreting as being the truth. And it's very complicated and murky, this issue around influences and people who are propagating false information on purpose to try to get their own advantage effectively. It's very difficult sometimes to disentangle what's true and what isn't if your main information source is social media. So that's an idea about what's going on when adults say they don't want to get vaccinated themselves. It's really complicated, it's very multifactorial. It can be vaccine dependent, nationality dependent, and all of those other factors we discussed. Perhaps then as the closest surrogate to animals in the human healthcare population, what about parents making decisions on behalf of their children? One of my former colleagues published a lovely paper which was entitled "Trusting Blindly is the Biggest Risk of All," in relation to parents deciding to vaccinate their children or not. And those parents talked about the idea of risk, choice, and responsibility. So it feels a lot more difficult to make a decision on behalf of your child. They were very influenced by what other parents that they knew did, whether or not they trusted healthcare workers, what their access was like to vaccines, but also this idea of population versus individual level values. So when you're deciding for yourself as an adult, you might feel, yeah, I can do this because I know it's protecting people around me. When you're making a decision on behalf of your child, all of a sudden you might think, I don't care about those other people. The most important thing is my child. And so actually I'm going to put their safety and on top of everything else. And so some people who got a vaccine for themselves perhaps were hesitant to get one for their child because it was quite a different decision-making process. They're not autonomous, you're making that decision for them. The weight of responsibility and the level of evidence of the safety you need may feel it needs to be higher. I put a picture there of the retracted paper that started the whole MMR debate when Andrew Wakefield published that. It's been fully retracted, but it is still available. And some people still very strongly hold those beliefs about the risks between MMR and autism. So you can see how powerful that information can be when it comes out and just how difficult it is to remove it from the public conscience once those ideas and those concerns have been seeded. So then what about pet owners? What do we know about them? Well, unfortunately, it's much more difficult to obtain reliable or comparable data, simply because the research hasn't been done and it's very difficult to collect these data without good funding. There's speculation that owners' beliefs may well transfer to animal health. And so if you have a very strong viewpoint yourself about whether vaccines are good or bad, safe or dangerous, beneficial or not, that's likely to transfer, we think, to your pets. We're not sure how many hardline anti-vaxxers there are. We think probably most people that you would meet would be vaccination hesitant rather than anti-vax, but the anti-vax people shout very loudly and are very keen to proliferate their views, so they may be seen disproportionately frequent. Many owners may seem to weigh up the benefits and risks of vaccination, and actually that's a really, really good thing that they're making considered decisions by themselves. And we know that vaccination rates vary widely across countries, between species, and again between diseases. And we start to see a bit of a phenomenon again in pet healthcare, where there may be certain vaccine types in certain countries that trigger concerns. So owners may say, yeah, I'm really happy to have these vaccines, but I don't want that specific one because I've heard something about it. And again, this is quite a challenge for us as veterinarians sometimes, where you're confronted with an owner who maybe has some beliefs that are entirely false. But again, removing those beliefs and changing their mind can be really quite challenging. So here's an example of the information we do have about vaccination rates. There's 3 papers here, one from Germany and 2 from the UK, and those tend to reflect where most of this research is being done, typically using big data samples. So in Germany, in 2020, there was a survey that asked owners what they'd done, and about 50% of dogs then were up to date with their core vaccines. One from the UK used a big data set and found that about 78% of UK dogs, cats and rabbits had been vaccinated at some point in their lifespan. And finally, a different big data set using, again, veterinary computer records found that approximately 50% of dogs in the UK had had a leptospirosis vaccine in the year in which they looked. So this is why it's difficult to compare data, because we're looking at different methods of capturing the data, different databases that are being used in different nationalities and at different vaccines. But broadly, in the countries where surveys have been done, the majority of animals are getting vaccinated, but it certainly varies from country to country. Another piece of UK data from the PDSA's Pet Animal Welfare Report shows a bit of a trajectory from 2018 through to 2022, with dogs on the top, cats in the middle, and rabbits on the bottom for the percentage being vaccinated. So clearly, many more dogs are being vaccinated than rabbits, which is perhaps unsurprising. And broadly, dog and cat vaccines have remained relatively constant at approximately 80% of animals in the UK being vaccinated for dogs and about 60% for cats, with a bit of a wobble during COVID. And that was probably because actually many vets in the UK stopped vaccinating during the heat of the pandemic, because we didn't want people to have an unnecessary risk during our UK lockdowns of bringing pets to the vets. Are we going to find out more about vaccination hesitancy in pet owners? Well, hopefully. Pet Savers, which is a UK charity, have recently funded a PhD, which is being done by Shona, who's pictured here, at the University of Liverpool to better understand vaccination hesitancy, and we're still waiting for those data. But so far, they've identified, using, again, a big data set, looking at veterinary records, that vaccines are probably more likely in dogs and cats if the dogs and cats are neutered, if they're not raw fed, and if the pets live in a more affluent area. And that link with raw feeding is interesting. It's something that I think many of us have wondered, and it looks like there is a statistically significant difference within this cohort that they've looked at of raw fed versus not, having a link to vaccination hesitancy. Here's another data set from Kantar, working on behalf of NOAA, another UK-based organisation, about why people did vaccinate their pets. And interestingly, that looking at here on this graph, the majority of people said that they vaccinated their pets because they felt that vaccination was essential. So the cat owners in green and the dog owners in grey there. Second most important, I vaccinate my pet on the advice of my veterinary practice. And that's something we're going to come back to again and again, because this is such an important thing. Vets recommending vaccines are such an important reason that people do and don't vaccinate. If the vet hasn't recommended it, they may feel it's not important to them. The one with the triangle there at the bottom is interesting because it says I vaccinate my pet because my pet owning friends and family do. And actually the number of people who said that as a reason increased by 17% during the pandemic. And so this again suggests that this public discourse, public conversation about vaccines and whether they're good or bad is maybe starting to spill over into our pet owner population, that perhaps they're discussing more frequently with their friends and family about whether or not their pets are going to be vaccinated. And in a good way, if your other friends have vaccinated their pets against diseases, they may be encouraging people to do so. So that's an interesting one to watch, I think, is now the discussion about vaccinations decreasing again in our media, whether or not that will dip back down to baseline levels again. So why do vets think pet owners are hesitant? What does our population think about why pet owners might not want to vaccinate? The little list down the left-hand side is from a few different sources. A couple of papers that are there on the right. So people thought that owners didn't vaccinate because vaccines were too expensive. that they were worried about side effects or that they might cause illnesses, that vaccines weren't necessary. They might hold a belief that the vaccine isn't important for their pet. Certainly we hear people talking about concerns about the idea of over-vaccinating, so this idea again that we're weakening immune systems by giving too many vaccines, that the pet's too old. And I think many of us have a bit of a held belief that, they just can't be bothered. They don't think it's important enough to do that. And WSAVA ran a survey a couple of years ago, which some of you may have taken part in, asking vets whether or not they believe that anti-vaccination attitudes were growing. And again, similar sort of views from those vets as to why it might be that owners are hesitant. And again, very variable from country to country within the survey results as to how many owners were perceived to be hesitant. So again, that may reflect what we found in the adult choice data, that it may depend on nationalities as to how accepting people are of vaccines, also being relevant in the pet industry. So let's ask the source and ask pet owners themselves why they say they're hesitant. And actually, there are fewer data available on this, but where people are asked, they might say some things that surprise us. So pet owners might find actually that visiting the clinic's really stressful, particularly for cats, but maybe for dogs as well. Waiting in the waiting room, going in for the appointment, having that clinical exam, maybe something that their pet finds really stressful, that might put them off. For sure, the cost of the vaccine is there in the list, and that may be increasing at the moment, certainly in the UK, where we have a cost of living crisis. Costs of everything are going up, and that may mean that people are deciding not to vaccinate their animal as a way to cut costs. There's certainly uncertainty. There's uncertainty about whether vaccines are effective, whether they're safe, and certainly whether or not they're necessary. And that's particularly important in people with older pets that don't really mix with other pets. So maybe people that perceive their dog only walking on a lead around the block doesn't need a vaccine. Or they may believe that actually vaccines are only needed if the animal's going into kennels and theirs isn't. So there may be a mix of uncertainty and false beliefs associated with feeling that vaccines aren't necessary for their pet. They may be uncertain who to trust for information. Perhaps they're reading things on social media, accessing some of these views from these ardent anti-vaxxers, or reading other hesitant viewpoints. So they might not be sure quite where they can go for reliable information. But again, importantly, as we mentioned before, the vet didn't recommend it or themselves seemed unsure about whether or not the pet needed a vaccine. And that one is really, really important. And it's something that we can change. That's a really easy one for us to nudge ourselves. And again, we saw some decisions based on this idea that we talked about in children of whether or not we're vaccinating the population versus the individual. So am I protecting all of the dogs in my area, or is it just about my dog? And many people again saying the most important thing is my dog and their safety. That's my priority. So if I've got any concerns, forget about the other dogs in the population. I'm protecting my dog by not vaccinating them because I'm too worried about the safety or the efficacy. So when owners said why they didn't vaccinate regularly in the PDSA survey again from this year, UK data again, 10% their pet was too old or too young, 10% said that their pet doesn't come into contact with other animals. And again, we can maybe question that when we're in a consulting room, if people feel that and express that to us as to whether that really is true, thinking about fomite transfer, for example, aerosolized transfer of some of these diseases. But look at the 11%, my vet hasn't recommended it. And this is in the UK, where I think we would probably pat ourselves on the back and say we're pretty good at vaccination. 11% don't remember at least that their vet recommended it. 14% said it was too expensive, and 27% said they didn't really know why they hadn't vaccinated. So we don't know either why they hadn't, but clearly the messaging hasn't got through. So there's a big population within that not vaccinated that we can definitely nudge there by changing how we talk about vaccines. And again, when we do surveys of owners, asking them about information sources they like, their preferred information source is from the vet. And yet repeatedly, owners are saying they want information from the vet, but they're not getting it. And I was involved in some interviews of owners about vaccines, and I encountered a couple of people who said, I've got no idea what my animal was recently vaccinated against. And I hadn't really thought about it until you asked, and now I'm thinking about it. I have no idea what the vet put into the back of my cat's neck. I'm not sure what my dog's been vaccinated. That's not very good, is it? And so owners may want information that we perceive they already have. And this is a challenge. Why might that be? Well, I wonder, and this is just my conjecture here, that it may have started here. So in 2006, there was a paper published that was aiming to see how we could get owners to come into the consulting room after we set reminders. The purpose of the study was to look at clients' compliance with reminders that are computer generated effectively and identify why they did or didn't come. And this study found that vaccination reminders were the least likely to be attended at this point in time. Now, back in 2006, vaccinations, I think, were probably more likely to be in you come for your vaccination. We don't do too much else, and then you go home again. We probably discuss other preventive healthcare, but not that much more. And this paper recommended that actually perhaps to improve the uptake of vaccinations, we needed to start doing more of the idea of a health check. So bringing in screening and other sort of checks really into the vaccination consultation. This idea of a wellness check, the pet health check, the MOT, maybe started its roots here. And it's been great because it's been really popular as a notion, and more of us now, certainly in the UK, are doing this idea of a health check. But as a result, it's meant that our vaccination consultations are really busy, because often, again, in the UK, we'll start the consultation by saying, how are you getting on? How's your pet doing? Have you got any other problems? And so instead of being a preventive healthcare consultation, our lead is often, let's do a health check because we may not have seen your pet since last year. This is a graph that one of my colleagues produced nearly 10 years ago now, where she stood in the back of consults and counted how many different problems were discussed. And she identified that in the preventive medicine consultations in green, up to 8 problems at a time could be discussed. So we're discussing lumps and bumps, we're discussing teeth, we might be discussing weight, osteoarthritis. I mean, we may well be making diagnoses of entirely new problems. And these consultations then are much more busy than those red and blue line on the graph there, which are consultations that people have booked for a specific problem. So actually, perhaps as a result of us trying to improve the popularity of these sessions by introducing this idea of the health check, suddenly we're making these consultations very, very busy. And as a result, often these consultations are far exceeding the time for which they were allotted. So at the time this research was done, the blue line across the graph there is the 10-minute consult time. And you can see the more problems along the bottom you get, the more likely you are to exceed that consultation length. But it was already very, very difficult to keep to a 10-minute consultation. 48% in this survey of the preventive healthcare consultations overran their allotted 10 minutes. And so my hunch as to what's happening, and it's based to an extent on these papers that my colleagues and I published a few years ago from a combination of surveys and interviews with owners about their experiences in the UK of preventive healthcare consults, that actually what's happening is that the vaccine is being very much marginalised in preventive healthcare consults. We're concentrating so much on the health check, how's your pet doing, discussing all these other problems, and that we're almost forgetting to talk about the vaccine at all. Or maybe we just pop it into the animal's neck and say, oh, and your vaccination's done. And I certainly remember vaccinating pets and doing it almost during the flow of talking about something else. And the owner saying at the end, but you haven't vaccinated them. And I had, they just hadn't noticed because we've been discussing something else. And so the vaccine messaging can get really lost within the health check. And I think what we might have a tendency to do is to talk a lot about what vaccinations are and why they're important in our young animals. So when a puppy and kitten first comes in, we take a long time to explain, this is how we vaccinate, this is what we vaccinate, this is what we vaccinate against. And I think we perhaps have a tendency to think that owners are going to retain that information or not want it repeating in subsequent consults. Perhaps we repeat it when the animal's middle-aged or relatively young, when there aren't many other problems. But looking at the right of the screen there at the older pets, these are the animals that we're going to be picking up lots of other things in those health checks. And actually, it may be that in those ones, the vaccinations have become more marginalised and we're not repeating that information about why they matter. But looking at the data as to why owners say they don't vaccinate, this may be our key population. Owners don't think that older animals need vaccinating as often. They're more hesitant in these animals. So it may be that these are the ones where actually we need to have the vaccination back front and centre. You're here for a vaccination appointment and a health check, but it's the vaccine that we're here for first. And reiterating that information as to why we vaccinate, explaining why it's important in older pets, but also checking that they haven't encountered new information, because it may be 10 years since that animal was a puppy or a kitten. They may have been exposed to loads of different mixed information on social media. Even the pandemic may well have changed how they feel. And they may want some reassurance about safety, about efficacy, about necessity of vaccines. So I think we need to start by opening the door to those questions and not hoping that they won't be asked, but saying, how do you feel about vaccination? Do you have any questions? Is there anything that you'd like me to clarify with you? We need to make sure that we're covering that information every time we vaccinate an animal. So there's one idea about what we can do. What else can we do about vaccination hesitancy in veterinary practices? Well, I think the key points to remember and emphasise are that most owners in the surveys that have been done aren't hesitant, but they do want information. They want to know what we're injecting into their animals and why we're doing it. Owners can change their minds, and we might not know that. So we might assume that last year they were fine, and this year, actually, they don't want to have their pet vaccinated. Or equally, you might read a note on the computer that says owner declined vaccine last year and think, oh, well, I'll save some time. I won't bother mentioning it this year when I see them for something else. But actually, unbeknownst to you, perhaps they've changed their mind and they want to vaccinate their pet. But because you haven't mentioned it, they might think, well, the vet didn't talk about it, so maybe I don't need to do it after all. I think it's okay that many owners accept uncertainty, because there's lots of things about vaccination that we don't necessarily know. We're not certain that that dog definitely needs that vaccine. We think it probably does, but we can't be 100% certain. And so it's okay to be honest, I think, about what we do and don't know about vaccines, but it's really important that we know ourselves what we do and don't know about vaccines to be able to talk coherently to owners about it. And I personally really like the acronym of BRAIN. I really like, when I'm talking about medicines, to talk about the benefits, the risks, the alternatives, what if we do nothing, and what the evidence base is for that. And yes, it takes time, but if we really want to nudge our clients in the right direction, making sure that they're making good, informed decisions that are right for them, that they're confident in, that they can explain to their friends and family, then we need to be giving them this information. And I think this structure, this kind of checklist in our heads is really helpful. I think it's important to acknowledge that vaccines aren't universally safe, but equally it's incredibly difficult to get good information about vaccination safety from field data. And this cartoon talks about the difference between correlation and causation. And a lot of what we see in vaccine reports and a lot of media groups which have popped up about specific concerns about vaccines are actually talking about correlation, not causation. So this happened to my dog after it had a vaccine, and therefore it must be the vaccine. Well, we can't prove that. It could be that it was going to happen anyway. So these are very, very muddy data. But we know that they're not absolutely universally safe, as is any medicine isn't universally safe. And I think it's okay to talk to owners about that, but talk about the risks being relatively minimal. Talk about the concerns that we might have and how we might be able to look for them. I think also there's confusion amongst us as a population of vets as to how often we should be vaccinating, because there are lots of different guidance out there. And there are the WSAVA guidelines, which have been published, recommending certain vaccination stances, but it may be that the manufacturer of vaccines that you use or the group for which you work have a different vaccination strategy. These documents are publicly available, so it may be that your very engaged owners have actually read these guidelines and will bring them to you and say, well, you're not doing what it says here. So I think, again, it's really important that we know what information's out there that our public, our owners can access, and we understand it, and we can explain coherently our own stance. So this is why we do what we do, and we can explain it confidently, we can explain it honestly, and we can explain it clearly. Another piece of research I was involved in followed from the papers where we were interviewing vets and owners about vaccines. And we've got a group of experienced vets and owners together and asked them to help us to generate recommendations about how vaccinations could be improved. So we used lots of data that we've gathered from those interviews and from the surveys to make a list of recommendations. And then we asked this panel of people online to say whether or not they agreed, and used a process of going back to them again and again to reach consensus or reach agreement on which recommendations they thought would help. And this has been published in this paper. It's free to read in the veterinary record, and the reference to it is in your notes. And I would really recommend you having a look, because it includes a lot of data, and I'm not in any way expecting you to read this table. But this table is the 18 recommendations that ended up with the group effectively going through, and whether or not they recommended them. And all of them relate to preventive healthcare consultations and how you as an individual and you as a practice might be able to change what you do and have discussions internally to try to improve the uptake of preventive healthcare. And a lot of that was around consistency. So all of the practice doing the same thing, because owners were telling us that they could go and get vaccinated one year by a vet who gave them one piece of information, and then they go back, maybe even into the same room, but see a different veterinary surgeon the following year who may give them completely contradictory information. And that's very confusing if you're an owner. And it may be that things have changed, but it may be that those vets hadn't discussed what they talked about, that they didn't have a practice policy about how to vaccinate. They weren't sharing the same information sources. So these are a list of tips, basically, of things that you could try. So really worth a look, because all of these, they haven't been tested as to how much they will improve vaccination rates, and we would love to do that. But there's certainly recommendations that vets and owners agree may make a difference. And the key relevant points from that were really, as I've said, consistency across the team matters. So knowing what your colleague next door is saying and knowing that you've got a coherent strategy around vaccination seems to be really important. A big takeaway was that vaccination consultations need to be longer. They're complicated, they're difficult, and actually we're probably just trying to cram too much in, and the vaccine part of it is being pushed out. So we need to make the consultations longer to accommodate all that we need to talk to. We should tailor the consultation to the pet in front of us, checking how much the owner knows each time and what information they might want. What do they want to discuss? And also, if possible, a big thing was trying to give a written plan, a leaflet, a link to a website that you trust and that they can read, so that if they want more information, they've got somewhere that's identified as a safe, clear place to go. Finally, what are they doing in human healthcare to try to improve vaccination uptake? Well, it's a nice systematic review. Again, lots and lots of studies being brought together that was published recently that looked at different nudges that are being done to try to increase uptake of the COVID-19 vaccine. Many of these studies are still ongoing, and most of them tested willingness to get vaccinated as an outcome. And actually, one of the interesting things they found was that what you say in the vaccination reminder seemed to make quite a difference. So personalized messaging seemed to be a lot more likely to get people to turn up for the vaccination than a generic message. And here's a paper that was published in Nature, which described an absolutely massive study of text-based nudges to improve the number of people coming in for a vaccination appointment. And this is just an example, and I just think this is an interesting one. We don't know about the relationships of this in veterinary medicine yet. It may be that at some point this will be tested in the future, but it's worth thinking about how you send your vaccination reminders. Because the key points here were that naming the person, saying, John, this is a message from your doctors. So using the pet's name, using the owner's name, saying this is a personalized message. It's not generic, it's for you. You have an appointment with this person, so they've already booked the appointment, and it's flu season. So it's saying this is why it's important. So we might be saying, you know, there's a parvovirus outbreak locally at the moment, or we know that there's concern in our area about leptospirosis, for example. Perhaps if you're in a country of rabies, it may be that, you know, that you want to put some relevant messaging in there about why you're vaccinating at the moment against this thing. Protect yourself and your family's health. So that messaging, again, it's not just for you, it's being altruistic. That seemed to make a big difference. So protect your pets and the pets around you. Protect your family's pets by getting them vaccinated. And look out for a reminder. So this is a series of reminders. It's not a one-off. And actually the reminder that's given is changing. So again, that seems to be important. If you're sending a reminder, not just to send the same text again, but to send something that's tailored and different, making it as personalized to the person, pet, and their circumstances as you can. And it would be great if we could test this. It would be so interesting because it may be a simple nudge that we could try. So in summary, vaccination hesitancy is complicated and it's evolving, but it's always been there. Since the days of Edward Jenner in 1796, we've had vaccination hesitancy. It's not the same as being anti-vax or anti-vaccine. It's linked, and hesitancy may lead to anti-vaccine, but we shouldn't tar these people with the same brush. They're very different populations. Vaccine hesitant people are in a process of decision-making. You can become hesitant all of a sudden if there's a new vaccine or there's new information. And social media seems to have a really substantial role in promoting these beliefs. There's not much data on it in pet owners, and we're trying to gather more. Hopefully that BSAVA study in the UK will help by really deep diving into why people are vaccine hesitant, and we're waiting for those results eagerly. But we have had strategies to mitigate it that we've proposed. And that paper that I discussed contains a big list of different potential recommendations. But broadly, build trust with your owners, take time to listen, and more than anything else, give them information. Don't assume that they want to vaccinate. Don't assume that they know what's in the vaccine. Don't assume that just because they vaccinated their young dog, they're going to want to vaccinate their old dog. Bring that vaccination discussion back front and center into vaccination consultations if on reflection it has been marginalized. And I think that's the way that we can promote it. We can see that there's an idea of an infectious nature of the more we vaccinate, the more people tell their friends and family that their pet's been vaccinated, the more likely they are to vaccinate. So by really doing a good job of explaining what we're doing and why to one person, that may substantially increase their friends and family's uptake of vaccinations. Thanks very much. I hope that was useful, and happily answer any questions in the text box. Thank you.
Thank you, Dr. Belshaw, for this truly informative and interesting talk on vaccination hesitancy. I'm sure many in our audience have experienced this concern with some clients, so it's really helpful to have this information. We wanted to move on to a few questions on this topic. The first question is, it seems that many people got pets during the pandemic and vaccination was a mainstream topic in human health. Do we know if this new group of pandemic pet owners is more or less vaccine hesitant?
Great question. And I think the answer is, as yet, we're not really sure. It was a really challenging time during the pandemic, certainly in the UK, because vaccines actually weren't available to quite a lot of groups of people, because clinics were really just clamping down on doing very urgent work rather than necessarily vaccinations. And so I think we haven't yet had time to track whether or not those dogs are going to keep being vaccinated. It's research that I'm involved in, and I think we'll give it a couple more years of looking back at the data, because we're still gathering those data at the moment to find out what people's choices and beliefs are. And again, comparing populations is really, really tricky because the data sets just aren't there for comparison. But you could imagine that it would have done something, and it may be that people have split, into different groups of, now they've become more entrenched in the view that they had already, if that makes sense. So I think it'll be a time will tell one. It'd be really interesting to know what people's experiences are in other countries. Certainly, as far as we're aware from UK data, there hasn't been any really big changes as yet, but it'll be fascinating to look at that globally.
Many thanks for this response, Dr. Belshaw. We have another question. I have been in a position where a client remains vaccine hesitant despite me trying to mitigate their concerns. I feel if I push too hard, it may strain my relationship with them and they will leave my practice. What should I do in these situations?
Yeah, it's a really tricky one, I think. I've certainly been in that position before when I've looked back on consultations and thought, what could I have done differently? And I think we need to acknowledge that some people are going to have really strongly held beliefs that are based on information that may not be correct, or they may have concerns that override our perception of the benefits. And I think it's really just a case of not pushing too hard with those clients and trying to start as early as you can and talking to them about what it is that they're worried about and asking them to give you information about their concerns. It may be just that on that day they didn't have the headspace for taking on new information. So there's an idea of giving people something called an information prescription. So giving them a handout which includes a link to some information. And I think that's probably what I would do in those situations. Say, look, like, I understand that, that at the moment you don't want to vaccinate, but here's some information. Here's a website you can go and have a look at. And probably that it has your clinic number on there with a bit of information about how they can rebook. Feasibly, if you have time, I guess you could book in a phone call with them subsequently to see whether or not they'd read that information. But probably it's finding a website that that you trust, that's got information that you would like them to have a look at, and acknowledging that there are going to be people that don't want to vaccinate for whatever reason, I think, but trying to follow the guidance that we've got in that Delphi paper around setting yourself up for the best chance effectively in these discussions, and trying to give them the best information in the best way, and giving them the space to discuss what it is that they're concerned about. But don't be too hard on yourselves. I think some of these consultations are really, really tough, and it may be years and years of incorrect information or consults in a way that they didn't like, that have layered up to give them that sense at present. And again, it's an indecision time. They may come back to you, so give them that opportunity, I think.
Many thanks again. We have time for one more question. In the past, I remember some people advised frightening owners into getting their pets vaccinated by showing graphic images of the effects of the disease we were protecting against. However, I don't see this being advocated nowadays. Is this no longer regarded as a successful approach?
Yeah, interesting one, right? I'd forgotten about this, and you're right, we did used to do that. And I'm not quite sure why it stopped, honestly. It may be that you would imagine that it would be quite a divisive issue, that some people would be persuaded by it and other people would be completely horrified by it. And I think the softer approach probably is more beneficial rather than scaring people into doing things. But it's certainly a role for making sure that people understand what these diseases are and why we should be vaccinating against them, because they need to understand that that these vaccinations are protecting against diseases that could be fatal, but showing them in the consult room kind of graphic images probably isn't necessarily going to be the way to go. But giving that information in a softer way, again through website links, explaining to them in leaflet form or something like that what these diseases do and why it's important, is probably how we've moved now, rather than doing something like that. So I would say probably avoid doing something that would scare people, but think about giving that information just in a slightly softer way.
Many thanks again, Dr. Belshaw. This truly was an informative talk. Unfortunately, we are out of time. A quick reminder to our audience, your participation certificate will be sent to you after this event, and we look forward to seeing you in the next talk. Goodbye.